95%. That is the percentage of New Yorkers who have health insurance. That's one of the highest coverage rates in the country, and it took years of work from the state legislature to expand Medicaid and the Essential Plan. But now, all of that progress is set to be undone.
The largest and greatest loss of health care in American history.
For those who say, well, I'm not on Medicaid, it doesn't affect me, when that hospital closes, you and your family don't have anywhere to go either.
With the passage of the Trump administration's One Big Bill, we are going to see unprecedented cuts to critical safety net programs like Medicaid and the Affordable Care Act. And the numbers in New York are particularly alarming. $8 billion in funding cuts from our hospitals. Over 1 million New Yorkers enrolled in Medicaid could become uninsured. Hundreds of thousands of New Yorkers on the Essential Plan could lose their coverage. I am one of them. I'm a born and raised Brooklynite who loves this city more than anything in the world. The hospitals and healthcare institutions where New Yorkers like me get our care are facing uncertainty too. Without funding, they're gonna have to cut services, and some may even close. And on top of all that, now the federal government is attacking science and undermining trust in public health. What are people going to do? Is there anything that can be done to stop this?
From everything I'd seen, two elements of the big bill's cuts were dominating the headlines. Medicaid.
$880 billion in cuts to Medicaid.
Medicaid has been a savior for me and my child.
These new rules are being added to Medicaid.
And subsidies for the Affordable Care Act.
The battle continues in the nation's capital over health care subsidies.
Extension of the Affordable Care Act subsidies.
The ACA tax credit is what makes Obamacare plans affordable.
I knew that hundreds of thousands of New Yorkers across the state depended on Affordable Care Act subsidies to keep their premiums reasonable, especially small business owners and entrepreneurs.
Hi, Samira. Thanks so much for hopping on with me.
Yes, thank you so much for having me.
Samira Bennett in Westchester is one of those New Yorkers.
I am a mom, an entrepreneur, a licensed mental health therapist. I'm a licensed clinical social worker as well. I have a private practice. The tax credits have been pivotal in helping me actually be a business owner. I'm not only paying it for myself, but, for my daughter as well.
So you talked about, the fact that the tax credits might expire. What would that mean for you?
In all honesty, it would probably mean that I would have to go without for a certain period. Right now, I'm not sure how that would be possible. It's like everyone is like mortgage or health insurance.
Samira is far from the only New Yorker having to choose between healthcare and other essentials.
The way I hear, if they double up, basically you either starve or you pay your insurance.
So nice to meet you.
This is Robert Cabrera, a New Yorker by way of the Dominican Republic who now lives in the Bronx. He's one of the nearly 60% of New York City residents on Medicaid, whose life currently hangs in the balance of this public political battle.
Became a citizen when I was 11. And then when I got old enough and finished my high school and school, of course I worked. Became a mechanic. And unfortunately then my health went downhill. But I'm worried, of course, now with this big, beautiful bill happening.
Robert is disabled and a kidney donation recipient who requires anti-rejection medication to stay alive. I asked Robert, what are you going to do if your Medicaid gets cut?
Unfortunately, even the way I am, I might have to still work because I don't see any other way around. Unless our other politicians really wake up and say, no, you can't be doing this.
Robert mentioned something else entirely that added another dimension to this whole chaotic picture.
It's funny how they saying Tylenol caused autism. Really?
I'll say one other thing about Tylenol.
President Trump repeatedly gave out unproven medical advice.
Don't take Tylenol. If you're pregnant, don't take Tylenol.
So I asked someone who would know what's going on.
Tylenol, which is the brand name for acetaminophen, which is in NyQuil, Dayquil, Excedrin, and Patanol, does not cause autism.
This is Dr. Flores.
Thanks for having me.
Welcome and bienvenida. I have been a physician for 35 years, promoting with others the quality of health outcomes for communities that generally are quite underserved.
It seems like there's this disinformation campaign being disseminated into our communities from the federal government. How has that impacted patients?
Most people want to get the best care and keep them, their families and their children safe and vaccinated. But we're making it so much harder now. People are questioning things that they never questioned before. People question certain vaccines that have been pretty standard for decades. And
if you were to sum up where we are in this moment, how would you describe it?
Right now, we are in a crisis where people are not going to be able to get health care. Not only is your bill, your healthcare bill, going to go up significantly, you may not have a hospital to go to.
Health insurance and misinformation were only a piece of the picture. As Dr. Flores mentioned, massive funding cuts to hospitals are part of this too.
One of Western New York's largest healthcare system is anticipating the effects of the healthcare cuts.
Yet another blow to patients. Okay, so many families in Western New York are bracing for the closure of Tooth Buffalo therapy clinics.
And now this facility is slated to close in November, a direct result of the big, ugly bill.
The impacts of these cuts were already hitting institutions across the state, and the consequences were devastating.
It's the worst cry when you hear a mother screaming from her room because she's lost her child. And I can only see that increasing when we make cuts.
This is Jaquilla Smith, a registered nurse in the neonatal ICU at Oshai Children's Hospital in Buffalo, New York.
We are located in the 14215 area code. A lot of low poverty families. A family planning clinic has not, if it hasn't already closed, it's planning to close. And our patients are stuck now looking for other places to go. With Medicaid cuts, I can easily see lots of layoffs. And if you have lots of layoffs, you're going to have patients waiting to be seen. The patients won't get adequate health care. Patients who will not get those testings that they need. If we can't catch things ahead of time, we now have moms walking around pregnant and not knowing they don't have a heart rate.
In Western New York, hospitals like Oshai are going to be forced to lay off over 2,100 workers and take on around $250 million in uncompensated care. A little further down the hallway, Dr. Steven Turkovich, the president of the Oshai Children's Hospital, laid out the stakes in no uncertain terms.
We serve everybody in the 8 counties of Western New York. We take care of everybody regardless of their ability to pay. Medicaid is the single largest insurer of children's health. So any cut to Medicaid is going to disproportionately affect the patients and the families that we care for here. Medicaid, before all of this, really only covers about 60 to 70% of the cost of healthcare. So when you make more cuts to that, it makes it even more challenging to be sustainable.
What does that look like? Have things already begun to change?
You know, we want to invest in our community. We want to ensure that every child and woman does not have to leave Western New York for care, but the costs are just very, very challenging. I think every person who's working in healthcare is feeling the effects of what's coming down from DC.
These conversations made it clear that unless there is meaningful intervention, communities across the state will buckle under the weight of these concurrent crises. There's one last pillar of New Yorkers' healthcare that's under attack, one I knew about very intimately, the New York Essential Plan. Over the last 15 years, the Essential Plan has grown to cover over 1.5 million New Yorkers. It provides New Yorkers within 250% of the poverty level, like me, comprehensive benefits and $0 monthly premiums. It also covers Teese Buckmeyer, a 31-year-old mother and executive assistant.
You have the Essential Plan as well?
I have the Essential Plan, that's correct. I have it through the marketplace.
And what made you choose the Essential Plan rather than going with your employer's insurance?
Definitely affordability on a monthly basis with all the things I want to achieve in life, with helping take care of my sisters as well as taking care of my daughter. The only option for me was the Essential Plan, like there's no question.
How did you first find out about the changes?
I saw clips on social media of the administration talking about cutting, funds to healthcare and so on, cutting Medicaid. And I was like, well, is this gonna affect me? So I went and I looked it up and I realized it was. And that kind of clicked the light bulb on that it wasn't just gonna increase by like a couple of dollars or go to maybe from $25 to $50 a month, but it was going to increase to astronomical heights.
So we know what the federal government is doing, right? But what do you think that New York State, like what should our elected officials in Albany be doing right now?
They should be doing everything that they can to keep the essential plan. The essential plan is the reason so many New Yorkers can afford to keep their lights on, can afford to live, can afford to send their kids to extracurricular activities, get tutoring, get the help that they need. It is scary, but it is real, and it is something they should fight their hardest to prevent.
Over the course of these conversations, the consequences of these federal healthcare cuts became brutally clear. New Yorkers from Brooklyn to Buffalo will be forced into dire situations by losing access to life-saving treatments and preventative care. Hospitals will be strained and forced to reduce staff and services. Inequality will worsen. And simply put, people will suffer. I had one question I asked everyone I spoke to. What do you want our New York State leaders to do?
It is time to get people moving.
It's time for us as a community to stand together.
This is one of the states that when we get something going, everybody starts following.
How can it be restructured in a way that people don't lose everything?
I think about this as a we moment. We have a responsibility.
They should be fighting morning, afternoon, night. We can't control what happens on a federal level, but it's a time to be aggressive. We gotta rally back. We gotta fight.